Bankstown, a large and expanding district with many modern amenities. A suburb of well-kept homes and several busy centres with shops catering for the widest variety of needs. Named after Sir Joseph Banks, noted English botanist who came to Australia in the early days of our history, Bankstown is now one of the largest suburbs of Sydney. Contrasting strangely with progress in many directions, this large area, housing 134,000 people, lacks the most fundamental public service. This area is mainly unsewered. Waste refuse and water from sinks and baths drains into gutters in front of houses and becomes a menace to public health. For years, sewage has been dumped at the edge of the Bankstown aerodrome, dangerously near the settled area. It is tipped from open trucks into iron gutters where it runs into open pits and remains uncovered for many months. The dangers to the community of this primitive practice cannot be overemphasized. The official figures of the Bankstown Health Department are most significant. In 1955, 175 cases of hepatitis. The figures for the following year, 1956, show the alarming increase of 20% of all notifiable diseases. Shocking and horrible as these scenes are, they are shown on the screen in the interests of public health and safety. Some of these gutters and sewage pits are within 800 yards of people's homes. This pit, 300 feet long, has remained uncovered for a period of 10 months. A further menace to public health rises from the liquid overflow which seeps through the whole area. Soaking through the ground, it enters open drains and creeks, finally finding its way into the Georges River. On summer days, when risk of infection is high, this pool, one of 6 in a 2.5-mile stretch of river, is packed with children. At the new plant being constructed in Roberts Road, £240,000 are being spent on a new system of sewage tipping, but there will be few advantages. It will not get rid of this. Removals from schools and homes will still be carried out by the same antiquated method. A modern sewage system is the only solution. Garbage dumps like this, one of 3 in the area, are a breeding place for disease. Unfenced and accessible to the public, they are not in keeping with a sensible attitude towards community hygiene. A modern garbage disposal plant would do away with this. Meanwhile, the Bankstown Hospital, started 10 years ago and urgently needed by the residents of the district, remains unfinished. The people of Bankstown and their local representatives should demand that the federal government finance urgently needed reforms, should insist that the federal government stop wasting the taxpayers' money on heavy war expenditure. This year, £192 million has been allocated for defence. The money is there. Pressure is needed to force the government to provide money to finance these desperately needed utilities. The people of Bankstown should demand the fundamental services that will safeguard the health of their children, services that are in keeping with the needs of a progressive and responsible community.